Part 1. The history of pandemics is essential in understanding the medical, social, and psychological impact that pandemics have had on civilization. Pandemics have played a crucial role in shaping societies and cultures throughout history, with their effects often lasting for centuries. However, there has been a lack of attention in behavioral social sciences and psychiatry, which raises questions about how pandemics have impacted individual and group psychology. The term plague has been widely used to describe pandemics throughout history. The word plague stems from the Doric Greek word plaga, which means strike or blow. The term is used interchangeably to describe a particular, virulent contagious febrile disease caused by Yersinia pestis, any epidemic disease causing a high rate of mortality, or more widely, as a metaphor for any sudden outbreak of a disastrous evil or affliction. The word plague can refer to any kind of sickness in Greek and in Latin. The terms are plaga and pestis. The Bible is one of the religious texts that refer to plagues as a part of human existence. The book of Exodus mentions a series of 10 plagues that strike the Egyptians before the Israelites, who are held in captivity by the Pharaoh, are finally released. Some of the plagues are likely occurrences of elements, but at least a few of them are clearly of infectious nature. Lice, diseased livestock, boils, and possible deaths of firstborn likely describe a variety of infectious diseases, zoonosis, and parasitoses. Similar plagues were also described and referred to in Islamic tradition in chapter 7 of the Quran. Throughout the biblical context, pandemic outbreaks are considered both a part of nascent human societies and a part of the very ending of humanity. The beliefs associated with these accounts continue to shape public sentiment and perception of current and future outbreaks. Examined through the lens of Abrahamic spiritual context, serious infectious outbreaks can often be interpreted as a divine punishment for sins or, in its eschatological iteration, as events heralding the end of days, i.e., the end of the world. In the history of known, predominantly Western societies, there have been recorded pandemics that have shaped our history and society, including shaping the very basic principles of modern health sciences. The Black Death, which occurred in the mid-14th century, is perhaps the most well-known pandemic outbreak in history. The disease was caused by the bacterium Yersinia pestis and was transmitted by fleas that infested rats. The Black Death originated in China, and it is believed that it was spread to Europe through trade routes. It first arrived in Europe in 1347 and spread rapidly, killing millions of people. The death toll was estimated to be between 75 and 200 million people, with some areas losing up to two-thirds of their population. The impact of the Black Death on European society was profound, leading to changes in economic, social, and religious structures. One of the major consequences of the Black Death was the collapse of feudalism. The labor shortage caused by the plague led to higher wages for workers and a decline in the power of the aristocracy. This shift paved the way for the development of capitalism and the rise of the middle class. Additionally, the Black Death led to a crisis of faith in the Catholic Church, as people struggled to understand how a just and merciful God could allow such a devastating event to occur. This crisis contributed to the rise of new religious movements, such as Protestantism. The next major pandemic outbreak occurred in the 20th century and is known as the Spanish flu. The Spanish flu was a global pandemic that occurred between 1918 and 1919 and is estimated to have infected one-third of the world's population. The virus was highly contagious and caused severe respiratory symptoms, leading to the deaths of between 50 and 100 million people. Despite its name, the origins of the Spanish flu are still unknown. The Spanish flu had a significant impact on society, particularly in the United States. The pandemic occurred during the final months of World War I, and many soldiers returning home from the war were infected with the virus. The high mortality rate of the disease contributed to the sense of loss and disillusionment felt by many Americans at the time. The Spanish flu also led to the development of new public health policies, such as mandatory vaccination and the establishment of the Centers for Disease Control and Prevention, CDC. In recent years, there have been several pandemic outbreaks that have captured global attention. In 2003, the Severe Acute Respiratory Syndrome, SARS, outbreak occurred in China, infecting over 8,000 people and killing nearly 800. The virus was transmitted through close contact with infected individuals and caused severe respiratory symptoms. The outbreak led to widespread panic and travel restrictions, particularly in Asia. In 2014, the Ebola virus outbreak occurred in West Africa, leading to over 11,000 deaths. Ebola is a highly infectious and deadly virus that is transmitted through contact with infected bodily fluids. The outbreak had a devastating impact on the affected countries, leading to widespread panic and economic disruption. Finally, in 2015, the Zika virus outbreak occurred in South America, causing concern due to its potential impact on pregnant women and their unborn children. The virus is transmitted through mosquito bites and can lead to severe birth defects in infants. The outbreak led to widespread travel warnings and the development of new public health policies. These pandemic outbreaks demonstrate the ongoing threat posed by infectious diseases to global health and well-being. Despite the advances made in modern medicine and public health, there is still much to be done to prevent and control future outbreaks. As the world continues to face new and emerging infectious diseases, it is essential that we remain vigilant and prepared to respond to these threats. The next pandemic that had a significant impact on human history was the Black Death. It originated in China in the 1330s and then spread along trade routes to the west. By 1347, the disease had reached the Mediterranean basin, and from there, it quickly spread to the rest of Europe. The Black Death is estimated to have killed 25 million people in Europe alone, which was roughly a third of the continent's population at the time. 9. The impact of the Black Death on European society was profound. The massive loss of life had significant social and economic consequences, leading to a shortage of labor that caused wages to rise and undermine the feudal system. The pandemic also created widespread fear and anxiety, which led to scapegoating and persecution of various groups, such as Jews and lepers. 10. The Black Death marked a turning point in European history, and its effects can still be seen today in the demographics and economic structures of the continent. Moving forward in history, the Spanish flu pandemic of 1918 was another significant event that had a significant impact on human society. The pandemic emerged during World War I and rapidly spread around the world, killing an estimated 50 million people, which was approximately 2.5% of the global population at the time. 11. The Spanish flu had a particularly devastating effect on young adults, who were otherwise healthy, which was a departure from the typical pattern of influenza outbreaks that primarily affected the very young and the very old. The impact of the Spanish flu on society was significant. The pandemic disrupted the war effort, with soldiers on both sides becoming sick and dying in large numbers. The pandemic also had a profound impact on public health policy, with governments around the world taking measures to prevent and control the spread of infectious diseases. The Spanish flu pandemic marked a turning point in the history of public health, with the development of new measures, such as quarantine, social distancing, and mask wearing, which have become standard tools in the fight against infectious diseases. In the 21st century, there have been several notable outbreaks, including severe acute respiratory syndrome, SARS, Ebola, and Zika. SARS emerged in China in 2002 and quickly spread to other countries, resulting in 8,096 confirmed cases and 774 deaths. 12. The outbreak had a significant impact on the global economy, with the travel and tourism industry being particularly affected. The Ebola outbreak, which began in West Africa in 2014, was another significant event. The outbreak killed over 11,000 people and had a significant impact on the affected countries' economies and health systems. 13. The response to the Ebola outbreak was also notable for its international collaboration, with countries around the world sending aid and personnel to help combat the disease. Finally, the Zika virus outbreak, which began in Brazil in 2015, had significant consequences for public health and international travel. The virus, which is primarily transmitted by mosquitoes, has been linked to birth defects in infants whose mothers were infected during pregnancy. 14. The outbreak led to travel advisories and restrictions in affected areas, and efforts to control the mosquito population became a priority for public health officials. In conclusion, pandemic outbreaks have had a profound and lasting impact on human societies throughout history. From the plagues of ancient times to the more recent outbreaks of SARS, Ebola, and Zika, infectious diseases have shaped the economic, political, and social aspects of human civilization. The response to these outbreaks has also driven advances in science and medicine, including the development of epidemiological principles, prevention measures, immunization, and antimicrobial treatments. Understanding the history of pandemics is essential for preparing for future outbreaks and developing effective strategies to mitigate their impact.